an unrelenting cough, no appetite, high fever, constant fatigue. This is no way to spend a childhood. More than 500,000 children suffer every year from tuberculosis, but exactly how many, we simply don't know. In most parts of the world, children sick with TB are often not identified. Many never make it to the doctor. And even for those who do, we don't have adequate tools to reliably diagnose the disease in children. Many of them go uncounted and untreated. Even if children are diagnosed, the right medicines to treat them simply don't exist. Doctors have to split or crush medicine or treat children with the wrong doses. As you can imagine, this can lead to mistakes in getting the dosages right. If the treatment is inaccurate, the infection can become drug-resistant, which is more dangerous and even harder to treat. New, more appropriate doses of medicine for children were actually recommended in 2010, and yet pills in these doses haven't been manufactured. Drug companies don't see the production of new medicine for kids, especially in poorer countries, as profitable. Because we don't know how many children are sick, they don't know how many pills they have to produce. We also need the cures themselves to be better and faster acting. Today's TB treatment must be taken for 6 months to 2 years. That's a long time to mix and match medicines with so much at stake. Research to develop new drugs has stalled for decades. For the past 50 years, we've been treating children as if they are just smaller adults. We still don't even know the proper doses of these drugs for babies. TB is a leading cause of death in children, and it thrives in poverty. When kids get so sick, and with the treatments so complex, parents who are struggling to make ends meet in the first place often have to take time off from work, and they don't get paid sick days. The disease spreads, causing more families to suffer, which leads to more poverty, and the whole cycle continues. We need to break the cycle and stop children from dying of TB. We know what to do: identify children exposed to TB, develop new and better child-friendly drugs, and help build systems that get these life-saving drugs to the children in need. This is happening, and it's being led by the TB Alliance, working with the World Health Organization, UNITAID, USAID, and other partners. Our children deserve better.